Discuss with facial and nasal trauma. Okay, face is divided into, what is in this picture? What do you see in this picture? Face is divided into three parts. Mid face includes eyes and face. So today we will discuss nasal fractures and fracture of floor of orbit, that is called blowout fracture. And these topics are very important. You might get scenario from these topics. So in the end of this lecture, you will have to diagnose all these cases. So fracture of the nasal bones, that is due to trauma, including mid-facial parts, nose and eyeballs. So fracture can be breast fractures if blow is from front, or can be angulated fracture if blow is from side. In this picture you can see blow is from side, from this side, and there is deviation of nasal bones. This is depressed on left side and hump is on right side. So how will you diagnose a nasal fracture? You will see the patient. There will be obvious external deformity if fracture is displaced fracture. If fracture is not displaced, there will not be any disfigurement, only there will be pain and tenderness. Yeah, when you will touch these nasal bones, it will be tender to touch. There will be swelling. If patient comes to you after 1 to 2 hours, there will be swelling of nose. There may be epistaxis if there is some internal tear to mucosa. And if fracture is displaced fracture, there will be external deformity. When you will palpate the nasal bones, there must be some crepitus. Crepitus are the crackling sounds beneath the skin, just like eggshell. Okay? Then you can palpate the broken ends of nasal bones. That is called step deformity. Broken ends, there will be gap between the two broken ends of fractured bone. So this is called step deformity. If fracture is involving the deflection of septum, there may be some obstruction due to deflection of nasal septum, or fracture of nasal bones may be associated with accumulation of blood beneath the mucoperichondrium, that is called hematoma. So along with fractured nasal bones, patient can present with epistaxis, patient can present with deflected nasal septum, or patient can present with septal hematoma. So diagnosis is based on clinical examination. Externally, there may be some laceration or tear of the skin. So there will be open fracture. Okay. If the skin is lacerated over the nasal bones and there is fracture, it is called open fracture. If trauma involving the eyeball or lateral part of nose, there may be some ecchymosis or bruises around the eyes, that is called black eye. When patient comes to you with history of trauma, always examine, always palpate all bones of the face, like periorbital bones. You will palpate margins of orbit, okay, lower margin of orbit, that is floor of orbit, upper margins of orbit, that is just below the eyebrows, then zygoma, cheekbones. You will examine the temporomandibular joint. You will ask the patient to open his mouth. Then you will examine the mandible. Okay. You will palpate all these bones. There might be some other fracture associated with this trauma. So rule out all other fractures. So diagnosis of nasal bone fracture is best made by clinical examination like this. You will see swollen nose, there may be some bruising. When you palpate, there will be obvious tenderness. You can palpate the broken ends of nasal bones if there is fracture, or that is called step deformity. Then there is some feeling that is called crackling sounds beneath the skin, like eggshell crackling sound. So then you will ask patient for radiological investigations. You will ask X-ray, nasal bones, lateral view. Okay. So you can see fracture of nasal bones. Fracture can be displaced or can be non-displaced. Just like in this fracture, there is fracture, but it is in contact with other piece, so it is not displaced fracture. You can ask for other radiological investigations like X-rays of paranasal sinuses to rule out fractures of other bones. So treatment, if fracture is not displaced, no treatment is given. You will give only the painkiller and anti-inflammatory, and after 7 days there will be complete improvement. If fracture is displaced, patient will present with swollen nose. So you will ask the patient to come after 2 to 3 days. When swelling reduces, you can see some external deformity, like in this X-ray, you can see there is displaced fracture. So there must be some external deformity. You have to correct this fracture. Okay. So how will you correct this or reduce this fracture? Close reduction is very important. Close reduction means you are making alignment of these fracture segments without without giving any incision in the skin. So close reduction is the method of choice. Usually it is done if patient comes to you immediately after injury. When there is no swelling over the nose, you can do it immediately. If patient comes to you after appearance of swelling, then wait for 3 to 5 days. When swelling reduces, then you will see external deformity and then do close reduction. Close reduction can be done up to 2 weeks. After that, these fractures get fixed, and this is impossible to correct it by close reduction. Sometimes patient comes to you with nasal deformity and deflection of nasal septum. Okay, so you can correct these deformities by open reduction. You will do septoplasty and you will reduce the nasal bone fracture. But close reduction is the method of choice. In this case, we will use this instrument that is called Welsham forceps. Okay, you will place one end outside the nasal cavity over the nasal bones and one prong inside the nasal cavity. Then by twisting movements means you will twist it like this, and then you will disimpact the nasal bones. After this disimpacting, you can bring these fracture segments into proper place, and then external splints that are made of plaster of Paris or some aluminium foil. So these external splints are placed. Internal splints are in the form of nasal packing. If patient comes to you late after 3 weeks and there is marked external deformity, then you will ask the patient for rhinoplasty. Okay, so rhinoplasty must be done after 6 months because rhinoplasty fibrous tissue gets mature So it is done after 6 months. Now another important fracture, that is blowout fracture. Blowout fracture is the fracture of floor of orbit. This is very important topic. You might get scenario from this topic. So weakest part of orbital cavity is the floor of orbit. Okay. So whenever there is blow from front, intraorbital pressure gets raised. So there will be fracture of floor of orbit, because this fracture will gives way to orbital tissues to herniate into the maxillary sinus. So whenever there is raised pressure inside some closed cavity, the weakest part gets fractured. So in this case, weakest part is the floor of the orbit. So it will give way, and orbital tissues that are orbital fat, extraocular muscles get herniated into the maxillary sinus. So fracture of floor of orbit, orbital tissue, orbital contents, it means orbital fat and extraocular muscles will herniate into the maxillary antrum. So what will be the clinical features? Patient will present with ecchymosis like this, and there will be black eye, bruising around the eyes, ecchymosis or bruising around the eye. There will be redness of conjunctiva, ecchymosis of conjunctiva and sclera. Anophthalmos. Anophthalmos means you will see eyeball is getting inside the orbital cavity. That is called anophthalmos. There will be displacement of eyeball inferiorly, because there will be entrapment of inferior rectus. Okay, so there will be diplopia. Patient will be unable to see upward and laterally because of entrapment of this muscle. Then you can perform traction tests like this. Okay, you can see that there will be entrapment of inferior rectus muscle. So 100% diagnosis will be made by CT scan. You will advise X-ray, PNS, that is occipitomental view. In this view, you can see maxillary sinus, and there will be herniation of orbital tissue. You can see in this, there is fracture of floor of orbit. So this is fracture of floor of orbit, and you can see herniation of soft tissue inside the maxillary antrum, like in this. CT scan will give 100% diagnosis. In this, you can see fracture of floor of orbit and herniation of soft tissue into the maxillary sinus. So treatment is done manually by Cardwell-Luck procedure. In this procedure, we will give incision, sublabial incision. Okay, sublabial means beneath the upper lip, in the gingival, few millimeter above the alveolar margin. And mucoperiosteum is raised, and 1 into 2 centimeter hole is made into the anterior wall of maxillary sinus, like in this. And through this hole, by manually with the help of finger or some instrument, orbital contents are pushed above into the orbital cavity, and some silastic sheet or some part of some muscle is taken, and it is placed at this empty space, at this broken, at this fracture site, and this maxillary sinus is packed with the help of ribbon gauze soaked in bismuth to form paraffin paste. Okay. Then this pack is removed after 5 to 6 days, and these fracture segments get healed, and there will be some silastic sheet between the fracture segments and orbital contents. Okay. So it will help in healing the fracture segments. All this procedure can be done with the help of endoscopes, that is called endoscopic sinus surgery. Endoscopes are the telescopes. We will pass it through the nasal cavity, through this nasal cavity, and through middle meatus we enter into the maxillary sinus through nose. And the same procedure is done with the help of these endoscopes. And there is no need of this incision, sublabial incision. All these procedure can be done inside the nose if we have endoscopes or telescopes, that is called endoscopic sinus surgery. So in the end, CSF rhinorrhea we will discuss. It is related to nasal trauma. CSF rhinorrhea means CSF, cerebrospinal fluid, coming out of nose. So etiology may be some congenital defect, may be due to trauma, or some tumor invading the intracranial cavity, or sometimes no reason is found, so it is called idiopathic. Sometimes after sneezing, patient can develop this CSF rhinorrhea, that is called idiopathic. So site may be anterior cranial fossa or middle cranial fossa. In anterior cranial fossa, most common site is cribriform plate. Cribriform plate is the weakest portion of intracranial cavity through which cerebral CSF can leak if it gets fractured. So fracture can be due to some trauma or some surgical procedures like endoscopic sinus surgery. You can puncture this plate, cribriform plate, so CSF can come into the nose, and patient there will be leakage called CSF rhinorrhea. So sometimes it comes from middle cranial fossa. So middle cranial fossa opens through middle cranial fossa. It will come into the sphenoid sinus, and sphenoid sinus drain into the sphenoethmoidal recess. Or if through middle cranial fossa it is coming into the ear, it can come into the nasal cavity through eustachian tube. So these are the two sides, sphenoethmoidal recess and eustachian tube, through which CSF rhinorrhea can come into the nose. So first of all, you have to differentiate between CSF fluid and nasal secretions. So there are certain points in cases of, because nasal secretions, which is usually related to allergy, sometimes patient can present with watery rhinorrhea that is due to nasal allergy. So you have to differentiate between CSF and nasal secretions.